Hello, and a huge warm welcome back to English Made Easy. I'm Eleanor.
And I'm David. It's so good to have you with us. Here at English Made Easy, our one and only mission is to help you learn English in the simplest, most natural way possible. We want to take the textbook and turn it into a real, useful conversation, something that you can actually use in your life tomorrow, or even today.
Exactly. And today we're talking about something that every single person has to do at some point, something that can be stressful even in your native language, going to the doctor. You feel sick, you're worried, you're not at your best, and the last thing you want is to struggle to find the right words to explain how you feel. It's a moment when you feel truly vulnerable.
It's so true. Having the right vocabulary in this situation isn't just about English. It's about taking care of yourself. It's about having the power to communicate clearly when your body is trying to tell you something important. Along the way today, we're going to walk you through the entire process from the very first phone call you make all the way to understanding a diagnosis and picking up medicine. We'll give you the exact words and phrases you need for dozens of different situations.
And we promise you this. By the end of our time together, you will understand exactly how to use these words, what they mean, their synonyms, and when to use them. You'll feel more confident and prepared for a situation that we all inevitably face. You'll have the tools to be your own best advocate.
So get comfortable, pour yourself a cup of tea or coffee, and remember to say the words after me to practice, even if you are just whispering to yourself. I'll speak with the natural rhythm of a native speaker, so you can get used to how it really sounds in a real conversation. Let's begin.
Okay, so let's set the scene. You wake up one morning and something just feels off. It's not one specific terrible thing, just a general feeling that you're not 100%. Maybe your head feels heavy or your throat is a little bit scratchy. Your first thought is, I think I need to see a doctor. The very first thing you have to do is make an appointment.
Right. That phrase is your key to getting started. To make an appointment simply means to schedule a specific time to see the doctor. It's like booking a reservation at a restaurant, but instead of for food, it's for your health. Let's say that together, slowly and clearly. Make an appointment.
Notice how those first two words, make and an, link together in American English. We don't say make an with the hard stop. We blend them smoothly. It sounds like make an appointment. The stress is on the second syllable of appointment, appointment. Try it. Make an appointment. Make an appointment.
And it's not the only way to say it, which is great because you have options. It means the same thing as to book an appointment or to schedule an appointment. They all work perfectly and are used interchangeably. I need to schedule an appointment sounds just a little bit more formal than I need to make an appointment, but both are completely normal. So you pick up the phone. Let's imagine the conversation. You'll hear the receptionist, the person who answers the phone at the clinic, say something like, "Dr. Smith's office, how can I help you?"
A great, simple response is, hi, I'd like to make an appointment to see the doctor. It's polite and direct. They will probably ask you if you've been to their clinic before. If it's your first time, you can say, no, I'm a new patient.
Let's pause on that word, patient. A patient is the person who is receiving medical care. If you are at the doctor's office, you are the patient. The doctor is the provider, and you are the patient. Let's practice the sound. It's not patient. The TI in the middle makes a sh sound, like when you're telling someone to be quiet. Shh. Listen, patient, patient. The stress is on that first syllable, patient.
A synonym might be a person under medical care, but honestly, in a real conversation, everyone just uses the word patient. It's the specific, correct term. So on the phone, the receptionist might then ask you to describe your symptoms.
And that is such an important word. Your symptoms are the signs from your body that tell you something is wrong. They are the clues you give your doctor to help them solve the mystery of why you feel sick. A headache is a symptom. A cough is a symptom.
feeling tired all the time is a symptom. It's anything your body's doing or feeling that isn't normal for you.
Let's say it. It's a little tricky because of the P sound in the middle that we don't really pronounce strongly. The P is very soft, almost silent. Symptoms. One symptom, many symptoms. Can you say that? My symptoms are.
Right. So the receptionist might ask, "What are your symptoms?" or "What's the reason for your visit?" This is just to get a general idea of how urgent your situation is. Urgent means it needs attention very soon. Urgent. Urgent. A high fever is urgent. A small rash might be less urgent.
You don't need to give a long, detailed story to the receptionist. You can be brief. Let's imagine you have a sore throat and a fever. You could say, I have a sore throat and a fever.
Let's break those down. First, sore throat. This is a perfect example of descriptive language. Sore means painful or aching. You can have a sore muscle after you exercise or a sore back from sitting too long. And a throat is the tube inside your neck that food and air pass through. So a sore throat is a pain in your throat, especially when you swallow.
Let's say it. Soar. It sounds exactly like the word soar, like a bird flying high in the sky. Soar. And throat. Throat. Be sure to get that th sound by putting your tongue between your teeth and blowing air. Throat. It feels scratchy. Maybe it even burns a little when you drink water. That's a sore throat.
Then you mentioned fever. A fever is when your body temperature is higher than normal. Your forehead might feel hot to the touch. Sometimes with a fever, you get the chills, which is a very strange feeling. The chills are when you feel cold and shiver or shake, even though your body temperature is high. It's like your internal thermostat is broken.
The doctor or nurse will use a special tool called a thermometer to check your temperature. Temperature is just the measurement of how hot or cold something is. In this case, your body. So having a fever means you have a high temperature.
Let's say the word for the feeling first. Fever. Fever. Simple enough. The other word for the tool is thermometer. Thermometer. The stress is on the mom. And the measurement is temperature. Temperature. In casual American English, we often say it faster, almost squishing the syllables together, like temperature. The nurse will take your temperature.
So you've told the receptionist your basic symptoms. They now have an idea of what's going on. They will look at the doctor's schedule and try to find an open spot for you. They might say, the doctor has an opening tomorrow at 10 a.m. Does that work for you? An opening here means an available time slot.
If that time is good, you say, yes, that works for me. If not, you could say, I'm sorry, I'm not available then. Do you have anything in the afternoon? You agree on a time and the receptionist will confirm it. Okay, we have you scheduled for Tuesday at 10 a.m. with Dr. Smith. Your appointment is set.
Before you go, they'll need some basic information, especially if you're a new patient. They'll ask for your full name, your date of birth, and your phone number. They will also ask about your health insurance. This is a big topic in the United States.
Health insurance is a plan that you or your employer pay for every month. In exchange, the insurance company agrees to pay for a large portion of your medical costs. It's a way to protect yourself from very high medical bills. They might ask, what insurance do you have? You would tell them the name of the company, like Blue Cross or Aetna.
The day of the appointment arrives. It's always a good idea to arrive about 15 minutes early, especially if it's your first visit. You will have to fill out paperwork. Paperwork is a general term for all the forms and documents you need to complete.
It's a bit of a funny word because it's not always on paper anymore. A lot of it is done on a tablet or a computer now, but we still call it paperwork. Paperwork. These forms will ask for your personal information and also your medical history.
Your medical history is the story of your health. It includes any past illnesses, surgeries you've had, any chronic conditions, and a list of any medications you are currently taking. A chronic condition is a health problem that is long-lasting, something that you manage over a long period of time,
like diabetes or asthma.
That word is chronic. It comes from the Greek word for time, chronos. So it literally means a condition that lasts for a long time. It's the opposite of an acute condition, which is something that starts suddenly and is usually short-term, like the flu or a broken arm.
The paperwork will also ask about your family's medical history. This is because some health conditions can be hereditary, meaning they can be passed down from parents to children through their genes. Hereditary. Hereditary.
After you finish the paperwork, you go to the front desk. The receptionist will greet you. Hi, how can I help you? You say, hi, I have a 10 o'clock appointment with Dr. Smith. My name is David. They will almost always ask for your insurance card.
An insurance card is a small plastic card from your health insurance company. It has your name, your member ID number, and other information that the clinic needs to bill your insurance company. It proves that you have a plan to help pay for your medical costs. It's like a membership card for healthcare.
Let's pronounce that. Insurance. Insurance. The stress is on that middle syllable. Insurance card.
After they take your card, they might also ask you for a copay. This is a word you will hear a lot. A copay is a small, fixed amount of money that you pay for a doctor's visit right at that moment. Your insurance company pays the rest of the bill later. Think of it as your small share of the cost for that day.
It sounds like this. Co-pay. Copay. It's just two simple words put together. They might say, your copay today is $20. After you pay, they'll likely say, please have a seat in the waiting room.
The waiting room is exactly what it sounds like. The room where you wait until the doctor is ready to see you. You'll sit there, maybe you'll read a magazine or scroll on your phone, and you might be feeling a little nervous or anxious. To be anxious is to feel worried or nervous about something. Anxious. Anxious. Your mind is racing. What's wrong with me? I hope it's not serious. This is totally normal. You feel anxious, but you know you're in the right place to get help.
Soon, a nurse will come out and call your name. David? A nurse is a healthcare professional who works with doctors to take care of patients. They are often the first person you'll talk to in detail about your health concerns. The nurse might say, hi, I'm Sarah. I'll be your nurse today. Please follow me.
The nurse will lead you to a smaller room, an examination room or exam room for short. They'll often start by taking your vital signs. This is a very common phrase. Vital signs are the most important measurements of your body's basic functions. It's a quick check to see how your body is doing overall.
Vital means essential or necessary for life. And signs are, well, signs. So these are the signs of life. This usually includes your temperature, your blood pressure, and your heart rate.
Let's look at blood pressure. This is the pressure of the blood moving through your body's arteries. The nurse will wrap a cuff around your upper arm and pump it with air. The cuff is that fabric band that gets tight. It might feel a little uncomfortable for a moment, but it doesn't hurt. They're checking to see if your blood is flowing with a healthy amount of force. Let's say it. Blood pressure. Blood pressure.
They'll give you two numbers, for example, 120/80. This is a normal reading. If the numbers are too high, you have high blood pressure, which is also called hypertension. Hypertension. If it's too low, it's low blood pressure, or hypotension. Hypotension.
And your heart rate is simply how many times your heart beats in 1 minute. They might check it by feeling the pulse in your wrist or by using a little clip on your finger called a pulse oximeter. You can use the words heart rate and pulse as synonyms in this context. Heart rate, pulse. They will also measure your breathing rate and sometimes your height and weight.
After the nurse has all this information, they'll ask you a few more questions. They might reconfirm the reason for your visit. So, you're here for a sore throat and fever? They will enter all this information into your electronic medical record, or chart. This is the official digital file that contains your entire medical history.
Then, the nurse will usually say, "The doctor will be in to see you in a few minutes." Now you're alone in the exam room, waiting for the doctor. This is a good moment to take a deep breath and think about how you're going to describe your symptoms clearly. A great piece of practical advice is to write down your symptoms on your phone or a piece of paper before you even go to the doctor. When you're nervous, it's so easy to forget something important.
That is such a good tip. You'd think you'll remember everything, but then the doctor walks in and your mind goes blank. Having a list is so helpful. The doctor comes in, usually with a friendly smile, introduces themselves. "Hi, I'm Dr. Smith." And then they'll likely ask a very open question like, "So, what brings you in today?" Or, "Tell me what's been going on."
This is your time to explain. And this is where having the right vocabulary is so powerful. Let's explore the language of symptoms in much more detail. We already talked about a sore throat and fever. What if the problem is pain? Just saying, "I have pain," isn't very helpful. The doctor needs more information. Let's start with the very common type of pain, an ache.
An ache is a continuous, dull pain. It's not sharp or sudden. It's a persistent pain that just stays there, like a low, constant hum of discomfort. We often combine it with a body part, for example, a headache, a stomach ache, a backache, or an earache.
The pronunciation is interesting. The word is spelled A-C-H-E, but it sounds like ache, just like the word cake or lake. So we have head ache, headache, stomach ache, stomach ache. Let's say you have a pain in your head. It's much better to say, "I have a headache," which is specific, than just saying, "My head hurts."
Now, let's dive deeper into headaches. They're different kinds. You could tell the doctor, "I have a dull, throbbing headache." Dull means not sharp, the opposite of a sharp pain. And throbbing means the pain comes in beats or pulses, like a drum. Throbbing, throbbing. It feels like you can feel your heartbeat in your head. "My head is throbbing."
Or maybe the headache is a sharp, shooting pain. Sharp is the opposite of dull. It feels like a needle or a knife, very sudden and intense. And shooting means the pain seems to travel quickly from one spot to another. I get a sharp shooting pain behind my right eye.
You can also describe the location. The headache is at the front of my head. It's on the sides of my head. Or it's at the base of my skull. You can also describe the intensity. It's a mild headache, meaning not very strong. Or it's a severe headache, meaning very strong and intense.
Let's imagine a scenario. A bad, unhelpful way to describe your problem would be to just say, "I have a headache." It doesn't give the doctor much to work with.
A good, helpful example would be, "Doctor, for the last 2 days, I've had a severe throbbing headache, mostly on the left side of my head. It gets worse when I'm around bright lights." See the difference? You're providing clear, specific information. You're painting a picture of the pain for the doctor.
That language is so much more useful. Let's move on to another part of the body, the stomach. If your stomach hurts, you can say, "I have a stomach ache." But again, we can be more specific. Is it an ache or is it cramps? Cramps are a sudden, tight, painful squeezing feeling in your muscles. I have bad stomach cramps.
You might also feel bloated. To feel bloated means your stomach feels full and tight, like it's filled with air. Bloated, bloated. My stomach feels really bloated after I eat.
And what if your stomach feels upset, like you might vomit? The word for that feeling is nauseous. I feel nauseous. It's a tricky word to spell and say. It looks like it should be nauseous, but it's not. The sound is nauseous. Nauseous. The stress is on the first part. Nauseous. An easier synonym is to say, I feel sick to my stomach. That means the exact same thing and is perfectly fine to say.
The noun form, the name of the feeling itself, is nausea. Nausea. And the action of being sick is to vomit or throw up. Throw up is a very common phrasal verb and is used more often in casual conversation. I feel so nauseous, I think I'm going to throw up.
Let's practice that phrasal verb. Throw up. The doctor might ask, have you been vomiting? And you can answer, yes, I threw up 2 times this morning.
Other digestive system symptoms could include diarrhea or constipation. These are opposites. Diarrhea is when you have to go to the bathroom very frequently and your stool is watery. Constipation is when you can't go to the bathroom easily.
These can be embarrassing topics to talk about, but for a doctor, it's just information. They are very important clues. Let's practice the pronunciation. Diarrhea, diarrhea, and constipation, constipation.
The doctor might also ask about your appetite. Your appetite is your desire to eat. So they might ask, how has your appetite been? You could say, I have no appetite, or I've lost my appetite.
Let's move to the respiratory system, your breathing. We talked about a sore throat. You might also have a cough. A cough is when you force air out of your lungs with a sudden loud noise. The doctor will want to know more about the cough. Is it a dry cough, meaning nothing comes up? Or is it a wet cough or a productive cough, meaning you are coughing up mucus or phlegm?
Mucus and phlegm are the thick liquid that comes from your lungs or sinuses when you're sick. Phlegm is a very strange word. The PH sounds like F and the G is silent. It's pronounced phlegm, phlegm. Mucus is pronounced mucus, mucus. So you could say, I have a wet cough and I'm coughing up a lot of green phlegm. The color can be an important clue for the doctor.
Another common symptom is a runny nose or a stuffy nose. A runny nose is when liquid is constantly dripping from your nose. A stuffy nose, also called congestion, is when your nose is blocked and it's difficult to breathe through it. Congestion, congestion.
You might also be sneezing a lot. A sneeze is that sudden, involuntary explosion of air through your nose and mouth. Sneezing, sneezing. You might also have watery eyes. All of these symptoms together, the cough, the stuffy nose, the sneezing, often point to a common cold.
What about a more general feeling of being unwell? You can say, I feel fatigued. Fatigued is a stronger word for tired. It means you feel a deep exhaustion in your body and mind, a lack of energy. Fatigued, fatigued. A synonym is exhausted. I've been feeling completely exhausted for the past week.
Another common feeling is being dizzy. To be dizzy is to feel like you are spinning and you might lose your balance and fall. The room might feel like it's moving around you. When I stand up too quickly, I feel dizzy.
Let's say it together. Dizzy, dizzy. A good synonym for this is lightheaded. I feel lightheaded. It means almost the same thing, a feeling that you might faint or pass out. The feeling of being dizzy or lightheaded is called dizziness.
So you've described all your symptoms to the doctor using this rich, specific vocabulary. You've told them about the throbbing headache, the nausea, the fatigue. The doctor will listen carefully, nodding, maybe typing notes into their computer.
They might ask you clarifying questions like, when did this start? Or, on a scale of 1 to 10, with 10 being the worst pain imaginable, how would you rate your pain? Or, is there anything that makes it feel better or worse?
These questions help them narrow down the possibilities. Then they will likely do a physical examination. A physical examination is when the doctor uses their hands and simple tools to check your body for signs of illness.
They might start by saying, okay, I'm going to take a listen to your heart and lungs. They will use a stethoscope. A stethoscope is that device doctors wear around their necks with the two earpieces and the round metal disc at the end. They'll ask you to take deep breaths. Breathe in and out.
The word is stethoscope. Stethoscope. While listening to your lungs, they are listening for any unusual sounds, like wheezing. Wheezing is a high-pitched whistling sound when you breathe, and it's often a sign of asthma or another breathing problem. Wheezing. Wheezing.
Next, they might say, let me take a look at your throat. They will use a small flashlight and a flat wooden stick called a tongue depressor to gently push your tongue down so they can see the back of your throat. They are looking for redness, swelling, or white spots, which could be signs of an infection.
An infection is when harmful germs, like bacteria or viruses, get into your body and multiply, causing illness. Infection. Infection. A throat infection is very common.
They might also look in your ears with a special tool called an otoscope. They'll check your eyes, and they might gently press on your neck to feel for swollen glands. Then they might ask you to lie down on the examination table so they can check your abdomen. They will gently press on different parts of your stomach and ask, does this hurt? They are feeling for any tenderness or hardness.
They're gathering all the clues, like a detective. They combined what you told them, your symptoms, with what they find during the physical exam. Sometimes this is enough to know what's wrong. Other times they need more information. They might need to order some tests.
The doctor might say, I'd like to run some tests to get a better idea of what's going on. For example, if they suspect a throat infection like strep throat, they might do a throat swab. This is when they use a long cotton swab to take a small sample from the back of your throat. It's a little uncomfortable, but very quick.
They might also want to do some blood work. This is a very common term for taking a sample of your blood to be tested in a lab. The nurse, or a person called a phlebotomist, will draw your blood. They clean an area on your arm, insert a small needle into a vein, and collect the blood in small tubes. Phlebotomist. Phlebotomist.
People often feel nervous about getting their blood drawn, but it's a very routine procedure. The results from blood work can give the doctor a huge amount of information about your health, checking everything from your red and white blood cell counts to your cholesterol and blood sugar levels.
Another type of test is a urine sample. They will give you a small sterile cup and ask you to provide a sample in the bathroom. This can help check for kidney problems or infections. The word urine is the medical term for pee. Urine. Urine.
For other problems, especially injuries, the doctor might order imaging tests. This means tests that create a picture of the inside of your body. The most common one is an X-ray. An X-ray is used to see bones, so it's perfect for checking if a bone is broken or fractured.
Let's look at those words. A broken bone and a fractured bone mean the same thing. Fracture is the more medical term, fractured. An X-ray uses a small amount of radiation to create the image. It's completely painless. You just have to stand or lie still for a moment.
For more detailed images of soft tissues like muscles, ligaments, or organs, a doctor might order an MRI or a CT scan. These are more advanced imaging machines. You don't need to know exactly how they work, just that they are types of tests that provide very detailed pictures of the inside of your body.
So, the doctor has your symptoms, the results of the physical exam, and maybe the results of some tests. Now they can put all the pieces together and give you a diagnosis.
The diagnosis is the doctor's identification of what illness or problem you have. It's the official name for your condition. This is a key moment in the visit. The doctor might say, well, based on your symptoms and the positive throat swab, my diagnosis is that you have strep throat. Or, the x-ray confirms my suspicion. You have a small fracture in your wrist.
Getting a diagnosis can be a relief. You might have been worried it was something much more serious. Now you have a name for what's wrong, and you can focus on getting better.
Once you have a diagnosis, the next step is the treatment plan. This is what the doctor recommends you do to get better. For some things, like a common cold, the treatment is simple. The doctor might say, this is a virus, so antibiotics won't help. The best thing you can do is get plenty of rest and drink lots of fluids.
For a bacterial infection like strep throat, the treatment will be different. The doctor will give you a prescription for medication. A prescription is an official order from a doctor for a specific medicine. It's a piece of paper, or more commonly now, an electronic order sent to a pharmacy that allows you to get medicine that you can't buy freely over the counter. You often hear people call it an RX.
Let's practice the word. Prescription. Prescription. The stress is on the middle syllable, script. The doctor might say, I'm going to prescribe an antibiotic for you. An antibiotic is a type of medicine that kills bacteria. Antibiotic. Antibiotic.
Before the doctor gives you a prescription, they must ask a very important question. Are you allergic to any medications? To be allergic to something means to have a bad, sometimes dangerous, physical reaction to it. An allergic reaction can be mild, like a skin rash, red spots on the skin, or it can be severe and life-threatening.
The pronunciation is allergic. Allergic. The stress is on ler. You would answer, no, I'm not allergic to anything. Or, yes, I am allergic to penicillin. It's extremely important to be honest and accurate here. It's a matter of your safety.
The doctor writes the prescription and hands it to you or tells you which pharmacy it's been sent to. They will give you some instructions. I'm prescribing you amoxicillin. You need to take it twice a day for 10 days. It's very important that you finish the entire course of antibiotics, even if you start to feel better.
This is a crucial point. Many people stop taking antibiotics when their symptoms go away, but the infection might not be completely gone. Finishing the full course ensures that all the bacteria are killed. The doctor may also warn you about possible side effects.
Side effects are the extra, often unwanted, effects that a medicine can have on your body. They are not the main purpose of the drug. For example, a medicine might make you feel sleepy or give you an upset stomach. These are side effects.
It's a simple one to say, side effects. Side effects. The doctor might say, I'm going to prescribe an antibiotic for you. An antibiotic is a type of medicine that kills bacteria. Antibiotic, antibiotic.
The doctor should also ask you, do you have any questions for me? This is your chance to clarify anything you don't understand. Don't be shy. It's your health. You could ask, how long will it be until I start to feel better? Or, is there anything I should avoid eating or drinking while on this medication? Or, is it okay to exercise?
This is a big difference between a good patient experience and a bad one. A good doctor will encourage questions and make sure you feel comfortable. A good patient is one who is engaged and asks for the information they need. It's a partnership.
Before you leave, the doctor might suggest a follow-up appointment. A follow-up appointment is a future appointment to check on your progress. It's to follow up and see if the treatment is working and if you are recovering well.
You would hear,
I'd like to see you again in 2 weeks for a follow-up. Or, if you're not feeling any better in 3 days, please call the office. It shows the doctor is continuing to care for you. You leave the doctor's office with your prescription and a clear plan. Your next stop is the pharmacy.
A pharmacy is the place where you get your prescription medicine. In the US, you also often hear it called a drugstore. They are synonyms in this context. A pharmacy can be its own store or a section inside a larger store, like a supermarket or a Target.
The pronunciation is pharmacy. Pharmacy. You go to the counter and give the pharmacist your prescription. The pharmacist is the person who is professionally qualified to prepare and give out medicines. They are an expert on medications.
You hand them the paper or tell them your name and date of birth if it was sent electronically. You might have to wait a little while as they prepare your medication. This is called filling the prescription. When it's ready, the pharmacist will call your name.
The pharmacist will go over the medication with you. They'll confirm the name of the drug and explain the dosage. The dosage is the specific amount of medicine you should take and how often you should take it. The label on the bottle will have all the instructions. It will say something like, take 1 tablet by mouth twice a day with food. That is the dosage. The pharmacist will make sure you understand it.
The pharmacist is also a great person to ask questions. They are often more accessible than the doctor. You can ask, should I take this in the morning or at night? Or what should I do if I accidentally miss a dose? Or can I drink alcohol while taking this? They are a fantastic resource.
You pay for your medicine, and the price will depend on your insurance plan. The medicine will come in a bottle with a childproof cap and a detailed information sheet. You go home, and now you have a clear plan. You have a diagnosis, you have your medicine, and you know the dosage. You feel more in control.
That whole experience, from feeling sick in the morning to understanding your treatment, is full of specific language. But when you break it down, step by step, it's not so scary. You've successfully navigated the system.
It really isn't. Now, this was a pretty standard visit for a common illness. But what happens if the situation is more serious or if you need to see a specialist? The medical world is huge. The doctor you just saw, Dr. Smith, is likely a general practitioner or GP. This is a doctor who provides general medical care for all ages. They are your main doctor. But sometimes they need to refer you to someone with more specific knowledge.
To refer you to someone means to send you to them for expert help. Refer. Refer. The noun is a referral. My GP gave me a referral to a specialist. A specialist is a doctor who has advanced training in a specific area of medicine.
Let's explore some of the most common types of specialists you might need to see. For example, if you have a skin problem, like a persistent rash, acne, or a suspicious mole, your GP would refer you to a dermatologist. A dermatologist is a skin doctor. Der-ma-ta-la-gist. Dermatologist.
At the dermatologist's office, they might examine your skin with a magnifying glass. If they see a mole that looks unusual, they might want to do a biopsy. A biopsy is when they remove a very small piece of tissue to be examined under a microscope to check for disease, like cancer.
What if you are having heart problems? Maybe you're experiencing chest pain or an irregular heartbeat. Your GP would send you to a cardiologist. A cardiologist is a heart specialist. Car-di-a-la-gist. Cardiologist.
The cardiologist would likely perform an electrocardiogram, also known as an ECG or EKG. This is a test that records the electrical activity of your heart. They place small stickers called electrodes on your chest, and it creates a graph of your heartbeat. It's a very common and painless test.
For ongoing stomach or digestive issues, you would see a gastroenterologist. This is a specialist in the digestive system, which includes the stomach, intestines, and liver.
Let's talk about another very common specialist, the dentist. A dentist is a doctor who takes care of your teeth and gums. You should see a dentist for regular checkups and cleanings. A checkup is a routine examination to make sure everything is healthy.
At a dental checkup, the dental hygienist will first clean your teeth, scraping away plaque and tartar. Then the dentist will examine your teeth for cavities. A cavity is a small hole in your tooth caused by decay. If you have a cavity, the dentist will need to give you a filling.
The dentist might also take x-rays of your teeth to see the roots and check for problems that aren't visible. If a tooth is badly damaged, they might need to do a root canal or even extract the tooth, which means to pull it out. Extract.
Extract. And for your eyes, you see an optometrist or an ophthalmologist. An optometrist is the eye doctor you see for routine eye exams, to check your vision, and to get prescriptions for glasses or contact lenses. Optometrist. Optometrist.
During an eye exam, they will ask you to read from an eye chart to test your vision. They'll check for conditions like being nearsighted, you can see things close up but not far away, or farsighted, which is you can see things far away but not close up.
There are so many specialists. A doctor for women's health is a gynecologist. A doctor for children is a pediatrician. A doctor who treats cancer is an oncologist. A doctor for the nervous system, including the brain, is a neurologist. You don't need to memorize all of them, but it's good to be aware that for almost every part of the body, there is a doctor who specializes in it.
Now, let's shift gears a little. Everything we've discussed so far involves planned appointments. But what happens when something unexpected and serious occurs? What happens in an emergency?
An emergency is a serious, unexpected, and often dangerous situation requiring immediate action. If you or someone else is seriously injured or ill, you don't call the doctor's office for an appointment. You call 911. In the United States, 911 is the emergency phone number for police, fire, and medical help.
When you call 911, the operator, called a dispatcher, will ask 911, what's your emergency? You need to stay calm and speak clearly. State your location first, then explain what happened. For example, my father is having severe chest pain and is having trouble breathing. Or, there's been a car accident.
The dispatcher will send help immediately. An ambulance will arrive with paramedics. Paramedics are healthcare professionals who provide emergency medical care outside of a hospital. They're trained to handle critical situations. Ambulance. Ambulance. Paramedic. Paramedic.
The paramedics will provide initial treatment on the scene and then transport the patient to the hospital, specifically to the emergency room, or ER. The ER is the part of the hospital that deals with emergencies.
The ER is a very different environment from a doctor's office. It can be chaotic and busy. When you arrive, you will go through a process called triage. Triage is where a nurse quickly assesses each patient's condition to decide who needs to be seen most urgently. Someone with a heart attack will be seen before someone with a sprained ankle.
Let's talk about the vocabulary of injuries. What if you fall and hurt your ankle? It might be sprained. A sprain is an injury to the ligaments around the joint caused by twisting it. I think I sprained my ankle. The ankle will likely be swollen, meaning it's puffed up and larger than normal.
To treat a sprain, doctors often recommend the RICE method: rest, ice, compression, and elevations. If the injury is more serious, it could be a fracture, which we talked about earlier. They will do an X-ray to check. If it's broken, they will put your ankle in a cast to keep it from moving while it heals.
In any emergency situation, the goal is to get the person stable and then figure out the next steps. They might be admitted to the hospital, which means they stay in the hospital for further treatment and observation, or they might be treated in the ER and then discharged, which means they are allowed to go home. Discharged. Discharged.
You know, David, all this talk about physical health is incredibly important, but there's another side to our well-being that is just as critical. And for a long time, people were afraid to talk about it, and that's our mental health.
You are absolutely right, Eleanor. Mental health refers to our emotional, psychological, and social well-being. It affects how we think, feel, and act. And just like our physical health, our mental health can have its ups and downs. It's okay to not be okay.
And it's okay to ask for help. If you're struggling with your mental health, you might see a therapist, a counselor, or a psychologist. These are professionals trained to help people with their emotional and mental challenges. The treatment they provide is often called therapy or counseling.
Let's look at those words. A therapist is a general term for someone who provides therapy. Therapist. Therapist. A psychologist has an advanced degree in psychology and often specializes in different types of therapy. Psychologist. Psychologist. Notice the silent P at the beginning. A psychiatrist is a medical doctor who specializes in mental health and can prescribe medication. Psychiatrist. Psychiatrist.
People go to therapy for many reasons. They might be dealing with anxiety, which we mentioned earlier. Anxiety isn't just feeling nervous before a test. It can be a constant, overwhelming feeling of worry and fear that interferes with daily life. Anxiety. Anxiety.
Another common mental health condition is depression. Depression is more than just feeling sad. It's a persistent feeling of sadness and loss of interest that can make it difficult to function. You might feel hopeless, lose your appetite, and have trouble sleeping. Depression. Depression.
In a therapy session, the therapist will provide a safe space for you to talk about your feelings. They won't judge you. They will listen and help you develop coping mechanisms or coping strategies. These are methods and techniques you can use to deal with stressful situations.
For example, they might teach you mindfulness exercises, breathing techniques to calm anxiety, or ways to challenge negative thoughts. It's about building a mental toolkit to help you navigate life's challenges. Seeking help for your mental health is a sign of strength, not weakness. It's just like going to the doctor for a broken arm. You're taking care of an important part of yourself.
That's such an important message. And part of taking care of ourselves, both physically and mentally, isn't just about reacting to problems when they happen. It's also about being proactive. It's about preventative care.
Exactly. Preventative care is all the things you do to stay healthy and prevent illness before it starts. The most common example of this is an annual checkup or annual physical. This is a visit to your GP once a year, even when you feel perfectly fine. During this checkup, the doctor will do a full physical exam, check your vital signs, and probably do some routine blood work. They're looking for any potential problems before they become serious. They might also discuss your lifestyle, your diet, your exercise habits, if you smoke or drink alcohol. Another key part of preventative care is vaccinations, also called immunizations or shots. A vaccination is an injection that helps your immune system build protection against a specific disease, like the flu, measles, or polio.
The word is vaccination. Vaccination. You get a flu shot every year to protect against the seasonal flu virus. Children get a series of vaccinations to protect them from many serious diseases.
Preventative care also includes screenings. A screening is a test done to detect potential health problems in people who don't have any symptoms. You know, Eleanor, as we've been talking, I've noticed how many health-related idioms and phrasal verbs we use in everyday English. These are phrases where the meaning isn't obvious from the individual words. I think it would be really helpful to go over some of the most common ones.
That's a fantastic idea. Learners often find idioms tricky, but they make your English sound so much more natural. Let's start with a really common one. If you're feeling a little bit sick but not terribly ill, you can say you feel under the weather.
I'm not going to work today. I'm feeling a bit under the weather. It just means you don't feel well. It's a gentle, informal way to say you're sick.
What about when you start to get sick? You can say you are coming down with something. For example, I think I'm coming down with a cold. I have a scratchy throat. It means you feel the very first symptoms of an illness.
And on the other side, when you are recovering from an illness, you can say you are on the mend. Sarah was really sick with the flu, but she's on the mend now. It means she's getting better. She's recovering.
Here's a good one. If someone looks very pale and sick, you can say they look as pale as a ghost. You should sit down. You look as pale as a ghost.
After a doctor's visit, if the doctor tells you that you are perfectly healthy, you can say you got a clean bill of health. I was worried about my checkup, but the doctor gave me a clean bill of health. It's a great feeling.
What about a phrasal verb? We mentioned throw up for vomit. Another one is pass out or black out, which means to faint or lose consciousness. It was so hot in the room that he passed out.
If you're in a lot of pain, you might say the pain is killing me. This is an exaggeration, of course. My back is killing me today. It just means the pain is very severe.
When you recover from a serious illness or surgery, it can be a long process. You might say you need to get back on your feet. It took him a few months to fully get back on his feet after the operation. It means to recover and return to your normal life.
And finally, a very positive one. If someone has a close brush with death but survives, you can say they have a new lease on life. It means they have a second chance to live and they appreciate life more. After his heart surgery, he felt like he had a new lease on life.
You know, David, as we've been talking, I keep thinking about how we've covered the event of being sick. You feel bad, you go to the doctor, you get a diagnosis and treatment. But for so many people, health isn't just a series of separate events. It's an ongoing journey. It's about managing a condition every single day.
That's such an important point, Eleanor. We've talked about acute conditions, things that happen and then get better. But what about the chronic conditions we mentioned earlier? Things like allergies, asthma, or diabetes. These aren't things you just cure with a single prescription. They are part of your life, and learning to manage them brings a whole new set of vocabulary and experiences.
Exactly. Let's start with something incredibly common, allergies. We mentioned being allergic to medication, but allergies can be a much bigger part of someone's life. An allergy is when your body's immune system overreacts to a substance that is normally harmless.
That substance is called an allergen. An allergen is the trigger for the allergic reaction. For some people, the allergen is pollen from trees, which causes seasonal allergies, often called hay fever. For others, it might be dust, pet dander, or certain foods like peanuts or shellfish. The word is allergen. Allergen. It works against the histamines that cause the symptoms.
When you're exposed to your allergen, your body releases chemicals that cause allergy symptoms. These are probably familiar to many of us. Sneezing, a runny nose, itchy, watery eyes. You feel miserable, but it's not a cold because you're not actually sick with the virus.
To combat these symptoms, people often take antihistamines. This is a type of over-the-counter medicine that blocks the chemicals your body releases during a reaction. You've probably seen brands like Benadryl, Zyrtec, or Claritin. The word is a bit long, but it makes sense. Antihistamine. It works against the histamines that cause the symptoms.
For some people, allergies are much more severe. A food allergy, for example, can cause a skin reaction like hives, which are itchy, raised red welts on the skin. In the most serious cases, an allergen can cause anaphylaxis. This is a severe, life-threatening allergic reaction.
This is a very serious medical term.
Anaphylaxis. Anaphylaxis. During anaphylaxis, a person's throat can swell, making it difficult to breathe. It is a true medical emergency. People with such severe allergies must carry a device called an EpiPen.
An EpiPen is an auto-injector that delivers a dose of a medicine called epinephrine. This medicine can stop the severe allergic reaction and save the person's life. They have to carry it with them at all times. It's a constant reality for them.
Another common chronic condition, especially that often starts in childhood, is asthma. Asthma is a condition that affects the airways in your lungs, making them inflamed and narrow, which makes it hard to breathe.
Someone with asthma might have triggers, which are things that can cause their symptoms to get worse. Triggers can be allergens, like pollen, but also things like cold air, exercise, or smoke. When their symptoms suddenly get worse, it's called an asthma attack or a flare-up.
During an attack, a person might experience wheezing, which we talked about, that high-pitched whistling sound. They'll also have shortness of breath. This phrase is key. Shortness of breath is the feeling that you can't get enough air into your lungs. You feel like you're suffocating.
To manage their condition, people with asthma use an inhaler. An inhaler is a small, handheld device that delivers medication directly into the lungs. You put it in your mouth, press down, and breathe in the medicine. Inhaler. Inhaler. Some inhalers are for quick relief during an attack, and others are used every day for long-term control.
Let's touch on one more major chronic condition, diabetes. Diabetes is a disease where your body has trouble regulating the amount of sugar in your blood. This is often called your blood sugar level or glucose level. Diabetes. Diabetes.
A hormone called insulin is what helps your body use sugar for energy. In diabetes, either your body doesn't make enough insulin or can't use it properly. This means a person with diabetes has to constantly monitor or check their blood sugar levels.
To monitor their levels, they often use a small device to prick their finger for a tiny drop of blood, which is then read by a glucose meter. Based on that number, they may need to take medication or inject themselves with insulin. Living with diabetes requires constant awareness and careful management of their diet, which is the food they eat.
You see, for people with these conditions, medical language isn't just for doctor's visits. It's part of their daily conversation, part of how they manage their lives and stay safe. It's about explaining to a friend, I can't eat that. I have a severe nut allergy. Or telling a coach, I need to keep my inhaler with me when I run.
That's a powerful shift in perspective. It's not just about being a patient, it's about being the manager of your own health. And sometimes that management requires a more significant intervention.
Being an active participant in your healthcare is the most powerful thing you can do. It's the common thread through everything we've talked about today, from describing your symptoms clearly to understanding your hospital discharge papers to questioning a medical bill. It's all about you.
Understanding the language of health is the first step to taking ownership of your own story.
What do you think? After hearing all of this, what part of the healthcare system seems the most challenging to you?
Thank you so much for watching this video all the way to the end. It really means a lot that you chose to spend your time learning with English Made Easy. If you found even one idea here useful, please give this video a like. It helps more learners just like you discover our channel. And if you haven't already, make sure to subscribe and turn on the notification bell. That way, you'll never miss our next lesson, tip, or practice session. When you support the channel, you're not just helping it grow, you're also helping us create even more free content for learners all around the world. Together, we're building a community where English becomes easier, step by step. I'd also love to hear from you. Drop a comment below and let me know your biggest challenge in learning English. Your feedback helps me create videos that truly match your needs.
Thanks again for being part of English Made Easy. Keep practicing, keep learning, and I'll see you in the next video.